My name is Bruce Evans. I'm a physician anesthesiologist, and I'm the medical director of the Unisource Surgery Center in Troy, Michigan, and I practiced at William Beaumont Hospital in Royal Oak, Troy, Michigan for about 25 years. I was treated at William Beaumont Hospital, Royal Oak, and my surgeon was Dr. James Relly, and his partner, Dr. Brian Seifman, did my surgery. I have a positive family history. My father had cancer of the prostate and was operated on at age 65. He's currently 85 and is alive and is cancer free. So I did watch that, and the blood level, the PSA, and the insurance exam was up, and then I followed up on that and actually watched my PSA go up from 2.3 to 3.5 over a period of just a couple of months. So I was very lucky to actually watch it go up at probably a time when something was changing fairly radically. And I subsequently had a prostate biopsy, and one of the 12 biopsy specimens was positive, which means you have cancer of the prostate. There's no other way to look at it. And then I was faced with the treatment dilemmas from that point to decide what to do about it at age 55. After thinking about all of it and considering my age and hopefully that my life expectancy was extensive, I decided to undergo the robotic laparoscopic prostatectomy, and chose to have it done actually locally by surgeons with whom I was familiar, and set that up and went ahead and had it done. I had the robotic prostatectomy, and I feel quite certain that I could have been discharged from the hospital the night of surgery. I was up eating, feeling good, and really actually felt great. So you really have a dilemma as to what to do, but I, being young and I suppose being a little more surgically oriented, elected to have my prostate out. I really wanted it gone. And that's a dilemma that everybody has to face, and you just really, if you do have a diagnosis of prostate cancer, not all treatments are really available to everybody. It depends on how extensive your tumor is. Mine was very isolated. I was very fortunate. Not all people can have that. Some people would go right to radiation therapy or something of that type. Really no side effects from the surgery or the cancer treatment whatsoever. And I think that is a common theme. Some people do have side effects, some of them very significant, and it's something you need to keep in mind, but I'm in fact quite fortunate. I have a very good friend who has prostate cancer that's disseminated and probably not curable. However, he lives his existence is very normal. He does everything on a day-to-day basis that anybody else would want to do. His life is affected by it. He has to have ongoing treatment when his PSA goes up. It is a problem for him. And then I've talked to other men who had similar things to what I had, and their life is largely unaffected by this. And my father had a big open operation years ago. He had all the side effects from the surgery, incontinence and everything else that you can have, and he had an implantable sphincter, and that made his life much, much better. So I think the lesson is to, if you're diagnosed with it, just figure it's something you're going to have to deal with, and you're going to have to duke it out, do whatever you have to do to fight it, and get on with your life, because that's really all you can do. And it's not very commonly, if you catch this problem, prostate cancer, in the early phase and do have some form of treatment, it is a cure. It's not just palliation, and that's obviously what everybody hopes for. And you can have a recurrence, I think, at any time, but I think a significant amount of men will have treatment and will never see any recurrence of the disease at all, and we'll probably see hopefully minimal disturbance of their normal functions on a day-to-day basis if they do have this treatment. I think the family history is significant, and apparently if you do have brothers or a father that did have cancer of the prostate, you're definitely at increased risk of that. And I think prostate cancer research it is strongly in that direction, and I would hope that by the time my son gets to be age 40, that there may be a biological cure for it, so that people don't even need to have surgery.